Good afternoon, everybody. My name is Daniel Roig, and I'll be doing my presentation on lung cancer. A little bit about the etiology of lung cancer. Lung cancer is a disease that is predominantly caused by smoking or exposure to secondhand smoke. Most physicians believe that smoking causes lung cancer by damaging the cells that line the lungs. When you inhale cigarette smoke containing various forms of cancer-causing substances, changes in the lung tissue begin almost immediately. Additionally, after repeated exposure, the damage to the cells can cause the lung cells to act abnormally and develop cancer. There are two types of lung cancer. Small cell lung cancer, which occurs almost exclusively in heavy smokers and is less common than non-cell lung cancer. Non-cell lung cancer is an umbrella term for several types of cancers. Non-small lung cancers include squamous cell carcinoma, adenocarcinoma, and large cell carcinoma. And a few characteristics and what this looks like. Shortness of breath due to obstruction of major airways. Pleural effusion, which is essentially just fluid in the chest cavity. And hemoptysis. Lung cancer has been known to induce bleeding in the airway, which can vary in severity. Some statistics. The first to the left is a chart provided by the CDC, and it's the top 10 cancers by rates of cancer deaths. As you can see, lung and bronchus cancers lead female breast and prostate cancer pretty significantly. And to the right, we have some statistics for the year 2020 by the American Cancer Society. It says about 228,000 new cases of lung cancer, 116,000 in men and 112,000 in women. And then we should expect about 135,000 deaths from lung cancer this year, 72,000 of those being in men and 63,000 of those being in women. Some additional charts here, again provided by the CDC. On the left, we have rate of new cancers by race and ethnicity. You could see that white and black lead that category. It's about pretty even, I would say. And then to the right, we have rates of cancers by age groups, and the demographics that are leading this category would be ages 75 to 84, which honestly I was pretty surprised. I would expect this would, onset at least in the 50s to 40s range, but that was a pretty interesting statistic that I was able to gather from that. Right here we have diagnosis. There are various ways to diagnose lung cancer. First being imaging tests. An X-ray image of your lungs may reveal an abnormal mass or nodule. A CT scan can reveal small lesions in your lungs that might not be detected on X-ray. Next, we have sputum cytology. If you have a cough and are producing sputum, looking at the sputum under the microscope can sometimes reveal the presence of lung cancer cells. And I found that to be the most interesting test of them all. I did not know you could do that. I was always aware of the imaging test, the X-ray and the CT, but I did not know you could actually get down in there and examine the sputum under a microscope. So I found that to be pretty cool. And then last, we have a tissue sample, also known as biopsy, which is a sample of abnormal cells can be removed in a procedure called a biopsy. And if you notice to the left, I provided a picture. That is a CT scan, and you could see the abnormal nodule present, pretty significantly. So that's what that would look like under testing. And then we have treatment. First treatment would be surgery, which is the surgical removal of cancerous tissue or mass. Chemotherapy. Chemotherapy is often used after surgery to kill any cancer cells that may remain. It can be used alone or combined with radiation therapy. Next, we have targeted drug therapy. Targeted drug treatments focus on specific abnormalities present within cancer cells. By blocking these abnormalities, targeted drug treatments can cause cancer cells to die. Next, immunotherapy. Immunotherapy treatments are generally reserved for people with locally advanced lung cancers and cancers that have spread to other body parts. This seems to me like the most intense form. I always found it interesting that you could kind of manipulate the way your immune system can respond to these ailments. So I definitely find that to be the most interesting. And then to note at the bottom, the 5-year success rates of these treatments are noted to be at 56%. However, that is if the cancer is caught early on and still localized, meaning that it hasn't spread to other areas of your body. And this only occurs in 16% of all discovered cases. And if this goes beyond that localization discovery, then then the survival rate will fall to about 5%. Prognosis. What happens if a patient receives treatment? If a patient decides to receive treatment for lung cancer, he or she would set up a treatment plan coordinated by the physician. The physician would then recommend the appropriate form of treatment that would be most effective to the patient. What happens if a patient goes untreated? If a patient elects to go untreated, it could be because the side effects of the treatment will outweigh the potential benefits. Meaning if a patient, say, is very advanced in their diagnosis, and they may or may not be strong enough to survive a rigorous form of treatment. So this is one that would normally happen. When that's the case, the physician could recommend comfort care to only treat symptoms the cancer is causing, such as pain or shortness of breath. If a patient unknowingly goes untreated, chances are the odds of survival will not be high upon discovery, if discovered at all. And here are my references. Thank you guys so much for listening to my presentation, and have an excellent day.